A big ruling from the Supreme Court will affect you when it comes to medical care.
Today, the court upheld President Barack Obama's health care law. By a 5-4 majority, the justices ruled that the Affordable Care Act is constitutional. The ruling upheld the mandate that most Americans have to purchase health insurance. But the justices say the mandate amounts to a tax, and the majority ruled that the government can make some people pay higher taxes if they do not have health insurance. But the ruling could cripple a key part of the plan aimed at getting states to cover more people under Medicaid.
The whole decision has a lot of people asking what this means for patients here in Central Texas. KXAN's political reporter Josh Hinkle has been following the decision and its impact here on the Lone Star State. Josh.
That's right. What this ruling means, 4.1 million more Texans will likely have insurance coverage. The idea, more medical access at a lower cost. But when it comes to the state's poorest, more Medicaid funding is still up in the air. At his East Austin clinic, Dr. Guadalupe Zamora says 20% of his patients are low income. So he was pleasantly surprised hearing the Supreme Court's decision to uphold the federal health care reform.
The state of Texas has the largest amount of those uninsured patients.
Zamora says that group doesn't have many options, often not able to afford a visit to the doctor's office.
So they go to the emergency room and they don't realize how much more expensive it is.
A lot of folks think that these individuals always live under a bridge because they're homeless. These are the working poor. These are the people that really make some of our pieces of the economy hum.
Seton Healthcare, one of the state's largest hospital networks, applauded the court's decision. Especially expansion of the Medicaid program, something that already helps the disabled and very poor, mostly children.
There are people who need Medicaid services greater this year than they were last year.
Right now, Texas has about 3.4 million people enrolled in Medicaid. The court's move could boost that number up to 5.4 million, but it's something that could severely cost the state. Medicaid already makes up a quarter of its budget. In the last legislative session, state lawmakers left Medicaid underfunded by $4.8 billion. When they return in January, on top of paying that bill, they'll now have to decide whether to spend even more for the expansion.
It's going to be very difficult for the state of Texas to pay for that expansion, but we're going to have to. We're going to have to find a way to cover those people.
Either way, the next session will give lawmakers the opportunity to fine-tune the Medicaid system in the state. If they decide not to go along with the expansion, the court says there's no threat of losing the Medicaid funding Texas already receives. Until lawmakers do make a decision, the state hasn't started working on the Medicaid expansion just yet. Officials say they'll need guidance from the federal government first. Josh Hinkle.